Here is something your doctor knows about you that you probably do not know about yourself. How fast you walk. Not how fast you walk when you are in a hurry. How fast you walk normally. Your comfortable everyday walking pace. Because research from some of the largest and most respected aging studies in the world has shown that this single measurement, your normal walking speed, predicts how long you will live more accurately than almost any other simple test available, more accurately than your cholesterol level, more accurately than your blood pressure, more accurately than your weight. And most seniors have no idea this number is being quietly observed. Every time they walk down a hospital corridor, every time they cross a car park, every time they walk to the appointment desk. Today we are going to explain exactly what walking speed measures, what the numbers mean, and what you can do to change yours. Stay until the end, because the last thing we share will surprise you. Welcome back. Today we are talking about something that bridges physical fitness, biological aging, and longevity in a way that almost no other single measure does. Walking speed, gait speed, how fast your body moves through space on two legs. This sounds simple, almost too simple to be meaningful, but the science behind it is extraordinary. Why does walking speed predict longevity so powerfully? Walking seems like a basic, automatic activity. You think, you walk. But what is actually happening when you walk is enormously complex. Your brain must plan the movement, coordinate both legs, maintain balance while shifting weight continuously from one foot to the other, adapt to the surface underfoot, process visual information about the environment, and manage all of this simultaneously while often doing something else, talking, thinking, carrying something. Your cardiovascular system must deliver oxygen to the working muscles continuously throughout the walk. Your lungs must maintain gas exchange efficiently. Your muscles must generate force repeatedly and precisely. Your nervous system must coordinate all of these systems in real time. Your joints must absorb impact and transmit force with each step. Walking speed, therefore, is not just measuring leg speed. It is measuring the integrated efficiency of almost every major system in the body simultaneously. When any of those systems begins to fail, the heart, the lungs, the brain, the nerves, the muscles, the joints, walking speed declines, often before any other obvious symptom appears. This is why it predicts longevity so powerfully. It is a window into the overall biological age and functional reserve of the entire body. The research that established this. The most influential study on walking speed and longevity was a large analysis published in the Journal of the American Medical Association. Researchers pooled data from 9 large aging studies involving nearly 35,000 adults aged 65 and older. All participants had their walking speed measured. Then researchers followed them for years to track health outcomes and mortality. The findings were striking. Walking speed was a strong and consistent predictor of survival. Faster walkers lived longer, and the relationship was remarkably precise. For every 0.1 meters per second increase in walking speed, the risk of death decreased by 12%. The relationship held true regardless of age, gender, and regardless of many other health factors. A separate major study from the University of Pittsburgh found that among adults over 65, those who walked faster than 1 meter per second, approximately 1 comfortable step per second, had significantly better survival rates across all causes of death. The researchers concluded that walking speed was as informative about survival as many standard clinical measures. What the numbers actually mean. Here is how to understand where you stand. Very slow walking speed is below 0.6 meters per second. This is roughly equivalent to taking about 40 steps per minute. If you walk this slowly, it suggests significant functional decline and is associated with high risk of hospitalization, falls, and poor health outcomes. Slow walking speed is 0.6 to 0.8 meters per second. Still concerning. Associated with increased health risks and reduced independence over time. Average walking speed for a healthy senior over 65 is approximately 0.8 to 1.0 meters per second, about 80 to 100 steps per minute at a comfortable pace. Good walking speed is above 1.0 meters per second. This is associated with significantly better health outcomes and longevity. There is a simple way to get an approximate sense of where you are. Find a clear space of 10 meters, roughly the length of a typical hallway or 30 feet. Mark the start and end clearly. Walk at your normal, comfortable pace. Have someone time you from start to finish. If you covered 10 meters in less than 10 seconds, your speed is above 1 meter per second. Good range. If it took 10 to 12.5 seconds, you are in the average range of 0.8 to 1.0 meters per second. If it took longer than 12.5 seconds, your speed is below 0.8 meters per second and worth discussing with your doctor. What determines your walking speed? Understanding what drives walking speed helps you understand what to work on. The biggest factors are muscle strength, particularly in the legs, balance and coordination, cardiovascular fitness, joint health, particularly in the hips and knees, neurological function, confidence and fear of falling, and pain. Any condition that affects any of these will reduce walking speed. Arthritis slows it. Muscle loss slows it. Heart failure slows it. Parkinson's slows it. Pain slows it. Fear of falling slows it. Conversely, improving any of these factors improves walking speed. Can you improve your walking speed? And does improving it actually extend life? Yes, and yes. Multiple studies have shown that interventions that improve walking speed, exercise programs, strength training, balance training, pain management, treating underlying conditions, are associated with improved health outcomes and reduced mortality risk. The body responds to training at any age. The same resistance exercises we discussed in the muscle loss video directly improve walking speed by strengthening the leg muscles that generate the force for each step. Balance training. Simple exercises like standing on one leg, walking heel to toe along a line, improves the neurological coordination that allows faster and more confident walking. Treating pain allows people to walk the way their body is actually capable of walking, rather than the slow, guarded way that pain enforces. And psychological factors matter enormously. Fear of falling causes seniors to walk more slowly, even when their physical capacity would allow a faster pace. Confidence, built through exercise, through practice, through removing fear, directly increases walking speed. The 5 things that most effectively improve walking speed in seniors. The first is progressive leg strengthening. The sit-to-stands, heel raises, and seated leg raises we described in the muscle loss video are the most direct interventions. Strong legs walk faster. The second is daily walking practice with intention, not a slow shuffle. A deliberate, upright, slightly faster than comfortable pace. Your comfortable pace becomes your new normal. Pushing it slightly beyond comfortable is what creates adaptation. The third is balance training. Stand on one leg for 10 seconds. Walk heel to toe along a line. These exercises improve the neurological systems that allow faster and more confident walking. The fourth is treating the things that slow you down. Pain that makes you walk slowly deserves treatment. Ask your doctor about pain management, specifically in the context of your mobility. Fear of falling deserves a falls prevention assessment. These are solvable problems. The fifth is staying off the sofa. This sounds too simple, but the single biggest driver of declining walking speed in seniors is simple disuse. Sitting for many hours each day trains the body to be sedentary. The muscles adapt to sitting. Walking speed drops as a result. Breaking up long periods of sitting, standing up for 2 minutes every hour, taking short walks throughout the day rather than one longer walk, maintains the neuromuscular pathways that keep walking fast and confident. The surprising thing we promised at the end. Research published in a major clinical journal found something unexpected. When doctors were asked to estimate the walking speed of their senior patients, they consistently overestimated it. They assumed their patients were walking faster than they actually were, and when seniors were asked to estimate their own walking speed, they also overestimated it. People consistently believe they are walking faster than they are. This matters because the perception, I am still walking fine, I am still getting around, can delay awareness of a meaningful and measurable decline that is already affecting health. The 10-meter test we described earlier gives you an objective number, not a feeling, a number. Do the test. Know your number. And if your number is in the slow range, talk to your doctor. Not because it is too late, but because it is not too late. The research on improving walking speed in seniors is some of the most encouraging in all of aging medicine. The body responds, at any age, when given the right signal. Today we covered what walking speed tells doctors about how long you will live. Why walking speed is one of the most powerful predictors of longevity. Because it measures the integrated function of almost every major system in the body simultaneously. The research that established this and what the numbers actually mean. How to do a simple 10-meter test at home to get your approximate speed. What determines walking speed and what improves it. And the surprising finding that most people, including their doctors, overestimate how fast they are walking. Share this with someone who thinks they are still walking fine, but has noticed it taking a little longer to get from one place to another. The 10-meter test could tell them something important. Subscribe for a new simple honest health video every week. Walk tall, walk deliberately, walk with purpose. We will see you next time.